So every week on a Monday between 8 and 9, we're going to be going live doing lessons from the week. Started it last week, went down really well, so we're going to do some more. And this week we're doing tendon repairs. But we're doing it slightly differently. We're doing it on a different model. We're doing it on a strawberry pencil suite. So the reason we're going to do this session is because recently I've been doing a lot of tendon repairs, and the techniques I'm seeing, the surgical repair itself, the drawing of it, the planning of it, the knowledge is good. The execution, not so good. And these are the things that give you away in terms of experience. Surgery is a skill, it's also a performance, and the performance needs to be executed well. So in this tutorial, we're going to be covering the modified Kessler tendon repair. For me, it's my go-to repair if I have a choice. I think it's the balance between the number of strands crossing the repair site. I can do it 2-stranded, I can do it 4-stranded. I use a monofilament suture to do it, and I think I've got reliable results, and it gives me flexibility because I can do it in a small wound or a big wound, depending on my access. So, lessons from the week, modified Kessler tendon repair. We're doing it on a different simulation model. We're doing it on a strawberry pencil suite. This is not an advert for strawberry pencil suites, but it's just to show that you don't have to spend lots of money on different simulation models. Simulation is supposed to be about practice. We've got our MedSync simulated tendons, which are good, reusable, and easy to use. But if you want to go even cheaper and reusable and have something edible after you finish to reward yourself, you've got things like cubed suites. So I'm going to cut it. We're simulating a tendon repair of a flexor tendon. Suture selection. I like monofilament. I like proline. 3/0 for the core, 5/0 for the epitendinous. The core repair is going to be a modified Kessler. This can be a 2-stranded repair or a 4-stranded repair. See our latest video from last Friday on how to do the modified Kessler, but we've also got the videos on the Adelaide and the Cruciate repair. So, the first thing I don't want to see when I'm watching someone do a tendon repair is them crushing the structure circumferentially like this. At the site of the repair, it's going to have lots of scar, there's more risk of adhesions. You crushing the end is not ideal. Be flexible with your position and be in full control. The 2 grips you need are the mounted grip, so thumb and ring finger in the rings, middle on the angle, index finger on the shank. This is a MedSync needle holder. You can have a look in our shop to get one for yourself. And the palmed grip. The other technique you're going to need to know how to do is how to reverse the needle seamlessly, but again, we've got the videos for that. So the modified Kessler, I always grab the end of the tendon where it's already cut, and I only grab it where on one lip. So I don't do this, I don't do this. I'm using what I like about this suite to do it on, other than it being tasty afterwards, on a different one, not this one, is that if you crush it too much, it will just break, so you'll see it. So as a longitudinal bite, this is how I'm holding my needle holder. I'll do one zoomed in and one zoomed out. Longitudinal bite, 1 centimeter in distance. I've disengaged my needle holder. I'm mounting it straight away. I now need to do a side to side bite, going from my side to the far side. Pull it through. You can put a clip on the other end if you so desire. So this is where you need to turn the needle around. So it's holding the same position, not letting go of the forceps. Put the tip of the needle on the tendon and turn it. I've still got the tendon in the same place. You don't want to keep putting it down and grabbing it. It's not a good economy of movement. So now we're going to go side to side. You're going to pull it taut, keep it taut, and go side to side. Again, don't let go. Just follow the curve. It's a round-bodied needle, so you don't need to put force through. If you go through the loop, you will get caught tangled. So go on top and pull it. That's half of it. You need to now, so I've gone from my fingers mounted to my fingers palmed. I'm going to stitch backhand, exiting in the center. The risk here is that you exit through the back wall. You don't want to do that. You want to exit in the middle, in the core substance, which you can see there. So pass it through. Because I can't get any more rotation of my wrist, I've disengaged, I'm pushing it through from the back, and I'm pushing. You let it glide through, don't force it. It's a round-bodied needle, so it's harder to pass. I haven't let go of the tendon. I'm mounting it straight away, and it's done. I'm going to pull that first one so it's a bit more taut, and now I'm going to let go because I've done everything I need to do on this side. Now I'm going to do the other half. If you're getting value out of this, like the feed, showing you tendon repairs and how to do them, how to not make the dangerous traumatic mistakes that I've seen that might cause excess scarring and do not show good economy of movement. You need to match the other half of the tendon repair, so repeat the same steps. Grab it on one lip, pull it taut under tension this way, and you're going to see the different ways I hold the needle holder now. Just zooming out for you. I'm going down the far side, 1 centimeter bite, rotating, disengage the needle holder, like so. If I go through here, I'll get caught in the loop. So I'm going to go on top of the thread and push it through. I'm going to pull it through a little bit, mount it straight away, and pull it all the way. I now need to turn this suture around and go from far side towards me. So I'm going to keep a hold of the tendon with my left hand and simply rotate it. Yeah, so you disengage the ratchet so it's loosely, so it's not locked but you've got a loose grip on the needle. You plant it and rotate it. And then lock it when you're happy. Put it in from the side. Keep the tendon taut, keep it under tension so that it's not moving around. I'm in, but I haven't got enough length, so I'm going to disengage and push it in from further. Follow the curve, let it glide through. So my material has ripped apart a little bit, so I'm just going to re-grab it, but that's how easy it is to kind of damage these things. So you have to really try and control the pressure you put through the forceps. I think this model is really good for that because it makes you do it. Pull it through. I need to repeat the longitudinal bite. Go in. If you're getting value out of this, share, like it, and comment, ask questions. We've got a group for aspiring surgeons, medsyncltd.com/aspiring surgeons, or you can become a member on YouTube. Got lots of resources for the exams. So that's a 2-stranded modified Kessler. It's 2-stranded because you've got 2 strands crossing the repair site. This is good, but it can be better. How can it be better? You make it 4-stranded. The repair of this tendon is as strong as the number of times the suture crosses it. So 2 times is strong, 4 times is stronger, 6 times is even stronger, 8 times is stronger. But the more sutures you have, the more bulky the repair site is. In the fingers, you've got what's called pulleys crossing the fingers, crossing the tendon. If you have too bulky a repair site, it will get caught. So when you're trying to flex the finger, it won't come all the way down to the hand because it's getting caught in the pulleys. We're going to do a members only live recording. It'll be available tomorrow on how to access the fingers, the pulley, the hand, and the wrist. So, as I said, you can do this as a 4-stranded repair, and that's good practice. That's what I'm going to do. But this time, you repeat the Kessler, you come out just in front of where you did the last one. So it's just under 1 centimeter, really. Longitudinal bite. Follow the curve. You need to go side to side, so I'm going to turn the needle around, disengage the ratchet, but keep a hold of the needle. Twist. That didn't work, so I'm just going to go like this. Don't get caught in a loop. Keep the tension this way on the tendon and pass the needle just in front of the previous side to side. It's round bodied, so it will take a bit more effort than when using a cutting or reverse cutting to suture. So we're here. And then we do the longitudinal bite. And do the same on the other side. Again, the more pressure, the more damage. So do be careful. I'm just going to go in and come out in front of the other. Now I've got that, I'm going to hold the tendon. Need to turn the needle around, disengage the ratchet, and rotate, and just go straight across. Don't waste time. I know where I'm going. You need to anticipate. So it's a longitudinal, side to side. I'm not happy with that position, so I'm going to reverse it a little bit, and then re-guide it through. Too much damage, not good. So I'm going to go somewhere else. Like I said, tendons are friable at the site of the trauma, so you don't want to keep grabbing it and putting it down. Obviously this is a strawberry sweet, but it illustrates the point beautifully. Now palmed. That's my final bite, so I can just take that out and put it through. Now the tying. You want to tie parallel, not parallel to the cut, not parallel to the tendon, because if you tie it this way, it will bring it together. If you tie it this way, you'll pull the tendons apart. So it's a structural repair. It's a monofilament suture, 4 to 6 knots. 1, 2, the surgeon's knot. Parallel. It's not a strength competition. It's just till you see the ends touch. Let me zoom in on that. That's really, really, really key, I think. It's just till the ends touch, which they are. So I'm leaving it there. It's not a strength competition. It's not pull it as hard as you can. 1 knot is a reef knot. You need to do 5 of those. Don't keep grabbing the prolene at the same point because it will fracture. So I'm going further and further down, so I have to keep my short end a bit longer than normal. I'm going to do 1 more, and then I'm going to do the magic trick of how do you cut with scissors. Let's zoom out and show that. Ring finger, thumb, middle finger on the angle. You go open, you slide down, you angle it, and you cut flush above the knot. This is the trick right here. You need to bury that knot. So take a bite inside. And pull. And the knot goes in a little bit more than it was. Great. So, what were the key learning points for this repair? How do you secure your needle? Mount it. Let it face the body of the needle holder, this nice medicine tungsten carbide needle holder. Then when someone pushes their finger near it, it doesn't cut or injure them. What were the key learning points? You can do the modified Kessler as a 2-stranded or a 4-stranded core repair. My preference is to use a monofilament suture for the core. That's a 3/0 prolene on a round-bodied needle, because the number of times you pass the tendon across it, the suture across it, you're at risk of getting some damage to the other sutures if you use a cutting needle. Next thing, when you're doing your repair, you want to hold the repair site once and not drop it, because as you saw, it's really fragile at the ends of trauma where you've already cut the tendon. You're at risk of causing more damage, more scar. The more scar, the harder it is for the tendon to pass forward and backwards to allow a flexion of the finger. You can do this as a 2-stranded or a 4-stranded repair. There's balance to both. The more number of strands you have crossing the repair site, the stronger the repair, but the more number of strands of suture you have crossing the repair site, the bulkier the repair. The bulkier the repair, the harder it is for the finger to pass through, the flexor to pass through those things called pulleys. In our live session tomorrow, in the recording for the members only, we'll be doing a tutorial on how to access the finger. We'll be covering the Brunner incision, the mid-axial incision, accessing the palm, accessing the carpal tunnel, and opening the forearm. That's going to be a members only live tomorrow. So join the membership and you will know when that will be, what time. So let's draw out this modified Kessler tendon repair for completion and how we did it. If you can draw it, you can do it. So this was a model using the strawberry sweet, but you can use licorice as well. And then when you're done with it, you can just cut it out. We have our simulated tendon model, which you can see in the product tag below. But if you don't want to spend that money on a high quality thing, you can use something which is lower quality, but easily reproducible, easily accessible, and just bringing the ends together by moving the tape. There's no excuse not to practice, but to be a good surgeon, you have to practice your craft. So this is a tendon, and we're going to draw how to do it. A straight line means we're outside the tendon. A dashed line means we're inside the tendon. This is me sitting here. Looks exactly like me. So you go in and come out on top 1 centimeter. You then go in the side, which creates a loop on the side, and go all the way across to the other half and come out. You need to come back down here, which will create a loop here, and come out. And do the same thing on the opposite side. Come out 1 centimeter distance and go in through the side and go side to side. By going side to side, you create a loop here. You can't see that. You need to reproduce this straight line. So you come in here, which creates a loop here. Can't see that. And then you'll come out here. You can either tie it here and then it's a 2-stranded repair. 1, 2. Or you make it 4-stranded by repeating it. To repeat it, you just continue, come out on top. That should be a dashed line, shouldn't it? Or T. And go side to side. It creates a loop here, and you go side to side. You need to recreate this longitudinal, so you come in just in front, creates a loop, dashed, continuous. Dash, 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 come out on top just in front. You need to go side to side, creates a loop, and you need to end up back here. So 1, 2, 3, and then 4. The distance from the first one needs to be at least 1 centimeter. Monofilament suture is my preference. You can use braided. 3/0 is what I use for the core repair, and you can do an epitendinous. You can check out the video from last Friday on the modified Kessler technique. It goes through the core repair, and it should cover an epitendinous as well. But we also have our videos on medsyncltd.com/skills, which cover everything. Our members area in the resources group also has the Oxford Handbook for Plastic Surgery in PDF form. It has content for the MRCS exam. We've got lots of resources, live sessions for members, and all being well, we'll soon be getting discounts for exam banks for the MRCS. It's got lots of interview guides and those resources you need to get ahead in surgery. So our next session will be on Monday next week. It'll be another live session. We're going to try and do this every Monday between 8 and 9, covering techniques of the week and the things that I think are worth really honing in on. To be a good surgeon, you have to refine your craft. That was the modified Kessler. We're going to do this one more time if you're joining us. So the modified Kessler, so that 2-stranded or a 4-stranded repair, did a little schematic there. You can watch it on replay. And someone can tell me how much strength does an epitendinous repair add to the modified Kessler? The epitendinous repair, how much strength does it add to the core repair? Whilst you tell me that, I will prepare my suture. And then the other question is, what suture material can you use to do a tendon repair? And are there any specific features for the needle that you want that you have learnt in this tutorial today? So, hold the repair or the tendon, go in, longitudinal bite. The distance is 1 centimeter. Rotate, pull it through, Turn the needle around, getting stuck in the center. This is a strawberry sweet because training does not always have to be expensive and use the most fancy models. You can just use things that you find commonly. A catheter from hospital is also okay. This is just simulation. So the epitendonus adds 20% strength to the core repair and tidies up the repair site. I'm using a monofilament suture, 3/0 proline, but you can use a braided such as Ethibond. Needs to be a 1 centimeter bite, as we discussed. Follow the curve. It's a round-bodied needle that when you pass this needle past all these other sutures, it doesn't cut out the other sutures, making the repair fail. But it means you have to take your time passing the needle through. I'm just following the curve, and I'm flexible in how I hold my needle between mounted in the fingers and palmed like I'm doing now. You can tell me how many strands of repair this is. It is a 2-stranded repair, 1, 2. I'm going to tie it there because this is an acceptable repair. The key, 1, 2, grab the short suture and you just need to pull until they meet. You don't need to pull any harder, that's it. And then you do 4 to 6 knots because it's a structural repair with a monofilament. It's not a strength competition. You want to make sure your knot remains buried. How to cut with scissors. Ring finger, middle thumb, middle finger on the angle. In, open, slide down, and cut. How to secure your needle. Turn the needle point towards the body of your needle holder. This is a tungsten carbide, theatre quality needle holder by MedSync. You can check it out in the tags below. You want to place the needle point towards the body, so if anyone passes their finger near it, they don't cut it, and you can pass it back to your scrub practitioner if you're so lucky to have one. Again, training doesn't have to be expensive. We've got our nice reusable high quality tendon simulator with a table surface stabilizer, but you can also just use it on a sweet like this strawberry pencil or licorice, and it works equally as well. We did here today live the modified Kessler tendon repair. It's a core stranded, 4-stranded or 2-stranded repair. You can check out the full tutorial live, which is free, from last Friday, kind of covering the key points here. Available for everybody, but we've also got the members only area at medsyncltd.com/skills, which has some exclusive videos which we'll cover. We'll be doing this session every week on a Monday between 8 and 9. So we'll see you next week, Monday.